when any bacteria, virus attacking on the human body, any pathogen, any types of invasion happening in the human body, this pathogen is not following the route of meridian. अब पैथोजन ऐसा तो बोलेगा नहीं भाई मेरी एंट्री तो हार्ट 1 से हुई है तो मैं हार्ट 2, 3, 4, 5 में ही जाऊंगा. पैथोजन ऐसा तो बोलेगा नहीं. Pathogen will not tell that because I have entered from the heart 1, so let me go through the heart 2, then the heart 3, then the heart 4. Okay, pathogen will is not disciplined person, but pathogen can enter only from the path where you find the door. जहां पर रास्ता मिलेगा वहीं से तो पैथोजन एंटर करेगा ना. So pathogen is entering through the divergent channel, means it will attack in the heart, then it will go to the gallbladder, then it will go to the Ren meridian, then it will go to the urinary bladder meridian. What happening this all कि भाई इसने तो अटैक किया था हार्ट मेरिडियन से. और पैथोजन का मतलब कोई बैक्टीरिया वायरस नहीं. It might be bacteria virus, but it might be your negative thinking, or you're thinking negatively, you're stressful, you're having some shocking news in the life, suddenly you're sad, so heart meridian becomes sad. Now effect coming on the gallbladder, then coming on the Ren meridian, then coming on the urinary bladder meridian, and you are getting urine again and again. What is happening? ये आखिर हो क्या रहा है भाई? अगर हार्ट मेरिडियन पर आक्रमण हुआ है तो भाई चेस्ट पेन होना चाहिए था, या फिर वो सब होना चाहिए था जो सिर्फ हार्ट से कनेक्टेड है, बट इट्स नॉट हैपनिंग. सो नाउ दिस what happened exactly in the body? Divergent channel means horizontal channel. Pathogen can enter from one channel to another channel to another channel. So let's see the divergent channel of the heart. So look at here. So we know the heart 1 is located under the axilla. Heart 1 is under the axilla. We can also see this in the other image, heart 1. So when something is passing through the heart 1, it's going in the gallbladder meridian to the gallbladder 22. So let's see, this is the heart 1. This is the heart 1 under the axilla, the midpoint of the axilla. Now from the heart 1, if you go 3 chun down, that is the location of gallbladder 22. अगर मैं हार्ट 1 से नीचे आ जाऊं, I will reach to the gallbladder 23, sorry, gallbladder 22. It is the 3 chun down, 3 chun below. Then from gallbladder 22, if I coming to the central line, this is the gallbladder 22, coming in the central line. So the divergent channel move like this. Starting from the heart 1, then coming to the gallbladder 22, coming in the central line, touching the Ren meridian. Same from the other side. Same from the other side. So heart 1, then the gallbladder 22, heart 1, then the gallbladder 22. Then coming to the central line, then it's going upward and meeting to Ren 23. ये डाइवर्जेंट चैनल सीबी चैनल को फॉलो करते हुए हमारे सीबी 23 तक पहुंचता है, and it's also touching the tongue. But we know this is the heart channel. The couple of small intestine. So having intention to meet with the small intestine. ये हार्ट चैनल है. ये किसका कपल है? ये स्मॉल इंटेस्टाइन का कपल है. तो इसका इंटेंशन है कि भाई अपने कपल से जाके मिलेंगे. Want to meet with the couple. So it is going in the central line. Heart 1, GB22, heart 1, GB22, CB23. Now how will meet with the couple? Couple is a small intestine. So it will go to the UB1, because UB1 is the point where a small intestine meridian meeting. UB1 is the point where a small intestine meridian meeting. So now ultimately at the location of UB1, it's meeting with the couple small intestine, because we know heart and small intestine are connected. तो जब भी हम डाइवर्जेंट चैनल ऑफ हार्ट की बात करते हैं, द डाइवर्जेंट चैनल ऑफ द हार्ट स्टार्ट फ्रॉम द हार्ट 1, देन गोइंग टू द gallbladder 22, then reaching to the CV 23, then meeting on the UV 1. This is the route. Now, if there is a fire in the heart, go to the husband. Husband means small intestine, and ask what's happening, why the fire in the heart, what you're doing. अगर वाइफ को कोई तकलीफ होगी तो जिम्मेदारी किसकी है? हस्बैंड की. Then husband will be alert. Okay, I will do something, don't worry. So if there is a more fire in the yin, there are many points on the small intestine meridian, they will help yin. They will help you, right? Okay, so I will tell you, even in the center, it's touching the CV23, you are right. When the divergent channel coming, like this, from the heart 1, it's coming to the gallbladder 22, then it's coming to the central. Here it's also touching the CV23. Sorry, REN 17, CV 17. So in this way, if there is a heat in the heart, small intestine will help. How? The Leo connecting point of the small intestine meridian, there is SI7. SI7 is connected with the heart. So we'll set it the small intestine 7, and it will drain the heat of the heart. Okay, so we will remove the heat from the heart, and also we will remove heat from the small intestine. We will work at two places together. हम दो जगह एक साथ काम करेंगे. Then we will achieve the results. So let's see now. So this is the case, 45 years old female, suffering with the insomnia for 20 years. She has difficult falling asleep, and she does not fall asleep till the 1 AM in the night or later. रात को 1 बजे तक भी नहीं सो पाती है. We know the 11 to 1 in the night is the time of gallbladder, and if someone is not able to sleep in the gallbladder time, it means there might be heat in the heart, because gallbladder and heart is deeply connected. रात को 11 से 1 समय gallbladder का है, दिन को 11 से 1 का समय हार्ट का है. So during the day, 11 to 1 is the time of heart. In the night, 11 to 1 is the time of gallbladder. So if there is a heat in the heart, even the person will not able to sleep in the night during the 11 to 1 time. So as per the TCM diagnosis, when we saw the tongue of this patient, the tongue was very red. We have seen the tongue of the patient. जब हमने पेशेंट की जीभ को देखा, जीभ एकदम लाल. The tip of the tongue is red. And we know the tip of the tongue is representing the lungs and heart. The exactly tip is heart. So we can see there is too much heat in the heart. We can see the tip is red and swollen. जीभ एकदम लाल है, जीभ का टिप एकदम लाल है और swollen है, जो इस बात को प्रूव करता है कि हाँ, हार्ट में हीट बढ़ी हुई है. There is a heat in the heart. When the person having heat in the heart might suffer with the mouth also. जब किसी को हार्ट में हीट बढ़ती है, हार्ट में फायर बढ़ती है, तो उसे मुंह में छाले हो सकते हैं. The person might suffer with the thirst. उसे बहुत प्यास लगेगी, गला सूखेगा. Some person might be having palpitation, किसी को छाती में धड़कनें बढ़ जाएंगी. There too much heat in the body. And insomnia, right now we are talking about the insomnia. नींद नहीं आएगी. The face will be red, urine will be dark, and one very significant symptom, that is bitter mouth. Many person are having bitter mouth. कई लोगों को मुंह कड़वा हो जाता है. कड़वापन गर्मी का प्रतीक है. And the nightmares, the meaning of nightmares, means रात को डरावने सपने आना. Nightmares. नहीं प्लीज नहीं. द मेंटल इलनेस, रात को डरावने सपने आएंगे, आ भी सकते नहीं भी. ऑल द सिम्टम्स माइट बी प्रेजेंट और एब्सेंट. इट्स नॉट मैंडेटरी दैट पर्सन विल बी हैविंग ऑल द सिम्टम्स. सम सिम्टम माइट बी प्रेजेंट और सम सिम्टम्स, ओनली सम सिम्टम्स. समटाइम पर्सन आर सफरिंग विद हेलुसिनेशंस. कभी कभी लोगों को गर्मी इतनी बढ़ जाती है कि उनको वो कल्पनाओं की दुनिया में चले जाते हैं. राइट. And there are too much pain and swelling on the tongue. In the TCM, this protocol has been mentioned. We will discuss about this protocol. So when there is a heat in the heart, so I was talking about the 45 years old female having insomnia. 45 साल की एक लेडी को नींद नहीं आती है 20 सालों से. रात को 1 बजे तक जीभ एकदम लाल है, जीभ का टिप एकदम लाल है. ये इस बात का प्रतीक है कि हार्ट फायर बढ़ी है. द टिप ऑफ द टंग इज रेड. It is denoting there is a heat, heart fire. What is the treatment? The TCM line of treatment, clear the heart fire. So we have to clear the heat from the heart as well as from the small intestine. So we will work on the primary channel as well as we will work on the divergent channel. हम प्राइमरी चैनल पर भी काम करेंगे और हम डाइवर्जेंट चैनल पर भी काम करेंगे. राइट. सो वी विल वर्क ऑन द प्राइमरी चैनल ऑफ द हार्ट and we will clear the heat from the primary channel of the heart. We will also work on the divergent channel of heart and small intestine, both. And I already told you the small intestine 7 is the Leo connecting point. And the Leo connecting points means they are connected with the partner channel. हम जानते हैं कि Leo connecting point वो बिंदु होते हैं जो अपने पार्टनर चैनल से कनेक्टेड होते हैं. So this is the small intestine, this is the small intestine 7, this is the heart. So the Leo connecting point means it is connected with the partner channel. So when we want to sedate the heat from the heart or from the small intestine, we can sedate the SI7. तो जब भी हमें हार्ट में से गर्मी को निकालना हो या स्मॉल इंटेस्टाइन में से गर्मी को निकालना हो, हम SI7 को सेडेट कर सकते हैं. द SI7 इज द लियो कनेक्टिंग पॉइंट ऑफ स्मॉल इंटेस्टाइन. इट्स ए वंडरफुल पॉइंट. So I have told you the very good technique. Do the plum blossom. You might be aware what is plum blossom. So plum blossom therapy can be done here. So we can do the plum blossom or we can do the prickling from the toothpick. हम SI7 पर plum blossom का ट्रीटमेंट कर सकते हैं और टूथपिक से prickling भी कर सकते हैं. Let's see the plum blossom. You might be knowing, but I will show you once. So look at this is the plum blossom. It is available on the acupuncture stores. And we can tap the area with the plum blossom like we can see here. After tapping the area, you can see the little redness here. हम plum blossom की मदद से उस एरिया SI7 को टैप कर सकते हैं. We can sedate the SI7. And it's a wonderful therapy. Whenever heat in any meridian, you take the plum blossom and tap on the Leo points of the couple. Suppose someone is having heat in the heart. Who is couple? Small intestine. Do the plum blossom on the SI7. Suppose there is a heat in the liver. Who is couple of the liver? Tell me. Gallbladder. Do the plum blossom on the gallbladder, Leo point, gallbladder 37. तो जब भी किसी भी ये मेरिडियन में गर्मी बढ़ी हो, आप उसके यांग में जाकर प्लम ब्लॉसम से उसे टैप कर दे. डू द टैपिंग विद द प्लम ब्लॉसम. अगर लिवर में हीट बढ़ी है तो गॉलब्लैडर 37 पर टैपिंग कर दो, बिकॉज गॉलब्लैडर 37 इज द लियो कनेक्टिंग पॉइंट. So we have to tap on the Leo connecting point of the partner channel, of the yang channel, because we want to expel the heat. If we want to expel the heat, the yang channel will work very nicely. किसी के किडनी में गर्मी बढ़ गई है, किडनी में गर्मी बढ़ती है तो ब्रेन में ट्यूमर हो जाता है और इनफर्टिलिटी हो जाती है. The kidney heat can create the infertility and tumor in the brain. So how to expel the heat? Do the plum blossom or do the toothpick? So when patient is calling us, doctor, can you tell me something? Okay, then we know the toothpick is available everywhere. Okay, no problem. You want to expel the heat from the kidney. आप किडनी की हीट को बाहर निकालना चाहते हो तो किडनी के कपल मेरिडियन के पास जाओ और उसके लियो पॉइंट को प्लम ब्लॉसम कर दो. सो yin channels and the Leo point of couple channel. So more heat in heart. Do the plum blossom on SI7. More heat in the liver. Do the plum blossom on the gallbladder 37. Gallbladder 37 is the Leo point. More heat in the kidney. Go to the urinary bladder, and UB58 is a very good point. That is the Leo point. More heat in the lungs. Go to the large intestine. Li6 is the Leo point. More heat in the pericardium. Go to the triple warmer. Triple warmer 7. More heat. Anywhere is the heat is there. Wherever you find the heat. There are heat in the digestive part. Digestive part. Spleen. Go to the stomach and do the plum blossom or toothpick. So do the plum blossom or toothpick. Toothpick prickling, or we tell this PNST. PNST. या तो आप उसको प्लम ब्लॉसम करो या फिर आप उसे टूथपिक से प्रिकलिंग कर दो. किसको? लियो पॉइंट को. It will work like a wonder. Excellent. Too many questions? Sorry. Triple bomber 5. You are right. Triple bomber 5 is the Leo points of the triple bomber meridian. Okay. Okay, I will show you. मुझे आपका वो चाहिए iPad. So this is the triple bomb 5. Sorry. So Leo point of the couple meridian should be sedated. Do the plum blossom or prickling. So we can expel heat from the yin channel. तो हम yin channel से गर्मी को निकाल सकते हैं. So the person is having problem of insomnia. We want to expel the heart fire. So we are choosing the SI7, which is the Leo points of small intestine meridian, and we are doing plum blossom therapy, right? Other than that, what else we can plan? Let's see here. So the clear the heat from the heart and the heart primary channel and the divergent channel of the heart and the small intestine. Do the plum blossom on the SI7, right? So we will able to release the heart fire. तो यही हमने बात की है कि हार्ट के प्राइमरी और डाइवर्जेंट चैनल में से और स्मॉल इंटेस्टाइन के डाइवर्जेंट चैनल में से गर्मी को निकालें और प्लम ब्लॉसम करें तो ठीक हो जाएगा व्यक्ति. So let's see here. We have seen the symptoms of the heart fire. As per the TCM, this is the protocol. Heart 7, 8, 9 sedate. CV 14, 15 even method. And kidney 6, spleen 6 stone. This is the formula. ये फॉर्मूला है टीसीएम के अनुसार. अगर हम इस फॉर्मूला को अप्लाई करते हैं तो हार्ट की गर्मी निकल जाती है और व्यक्ति को नींद आने लगती है, मुंह के छाले भी ठीक हो जाते हैं. So let's see the location of heart 7, 8 and 9. So look at this image. Heart 7 is the source point of the heart. Heart 7 heart का source point है. Heart 7 is the sun point of the heart. Heart 7 is also the very good tranquilizer point of the heart. Heart 7 also called Shanman, who bring the peace in the heart. Heart 7 को हम Shanman भी कहते हैं, जो हमारे हृदय में ठंडक लेके आता है, पीस लेके आता है. So we are studying the heart 7. Other than that, if we talk about the heart 8 is the fire point of the heart. So we also studied the heart 8 because it's reduced the fire. Then heart 9. Heart 9 also the very good point, who expel the wind and the heat both from the heart. So we and heart 9 also the jingle point. So it's a wonderful point if we bleed it. अगर इससे हम ब्लड लेट कर दें तो भी बड़ा शानदार फायदा मिलता है. So heart 7, 8, 9 should be sedated. जब हम इन 3 पॉइंट को सेडेट करते हैं तो हार्ट की गर्मी निकल जाती है. Now we are coming to the central line. CV14 is the alarm point of the heart. CV14 हमारे हार्ट का फ्रंट व्यू पॉइंट है, ये अलार्म पॉइंट है. So CV14 is the front view point of heart, and CV15 is very good point, who is always helping upper part and the lower part, means who is helping the heart and also the digestion. CV15 एक ऐसा बिंदु है जो ऊपर को और नीचे को दोनों को बैलेंस करता है. CV15. So when we want to make any protocol for the heart, we always take CV14 and 15. Both point together work very nicely. दोनों point मिलकर बड़ा अच्छा काम करते हैं. So we are doing even method. Even method means perpendicular needle or the star magnet, neither tonification nor the sedation. ना तो हमें point को sedate करना है, ना tonify करना है, बल्कि even method से stimulate करना है. So this is the 14 and 15. Now finally, we are going to use two very excellent point, that is kidney 6 and the spleen 6. Kidney 6 and the spleen 6 are increasing the fluid in the body. ये दोनों बिंदु हमारे शरीर में पानी की मात्रा को बढ़ाते हैं और ठंडक लेके आते हैं. Kidney 6 and the spleen 6. So when we talk about the spleen 6 is a very wonderful point, and it's the meeting point of all the three meridian. यहाँ पर किडनी मिलती है, यहाँ पर लिवर मिलता है, और यहाँ पर स्प्लीन खुद भी मिलती है. So spleen 6 is the very good point, that is called meeting point, and spleen 6 is the very good point who increase the fluid in the body. ये हमारे शरीर में पानी की मात्रा बढ़ाता है. And when we are stimulating the kidney 6 is the point, master point of EOV. It is a super cooling point, that is kidney 6. From the medial malleolus, if we go one tune down, अगर हम medial malleolus से one tune नीचे जाते हैं तो kidney 6 मिलता है. The kidney 6 is the master point of extraordinary vessels, that is called yin heel vessel. ये yin heel vessel का master point है. That's why when we are using kidney 6 and the spleen 6, it becomes very wonderful protocol. And this is the completion of protocol as per the TCM. So as per the TCM, heart 7, 8, 9, sedate. So TCM protocol to reduce heart fire, applicable for mouth ulcer and insomnia and many other problems. ये mouth ulcer insomnia के लिए applicable है. Heart 7, 8, 9 sedate, CV14, 15, E1 method, and spleen 6 and the kidney 6 stone. So now let's go here. Let's see here. So the same protocol is written here. यही प्रोटोकॉल यहां पर लिखा हुआ है. Now as per the concept of divergent channel, first we have to stimulate the right gallbladder 22. Right gallbladder 22. Okay. Then we have to stimulate right urinary bladder 1. Then the left urinary bladder 1 and the left gallbladder 22. I will tell you again, don't worry. So let's see this. As per the concept of divergent channel, हमें सबसे पहले हमने ये पॉइंट लिया, राइट साइडेड gallbladder 22. Then we have taken right sided urinary bladder 1. Then we have taken left sided urinary bladder 1 and left sided gallbladder 22. So we have to take the 4 point. GB22, UB1, UB1, GB22. Right, right, left, left. We have to stimulate the point in a cyclic fashion. हमें इस तरह से पॉइंट को स्टिमुलेट करना होगा. Now after that, after doing this, we are stimulating the CV17 and the CV12, 2 points. CV17 and the CV12. The divergent channel of the heart having indirect connection of the with the CV17. Indirect connection. It is connected but indirectly, not the directly. Heart का जो divergent channel है वो इनसे indirectly connected है. So we are stimulating the CV17. We know the CV17 is a very important point. They are the master point of divergent channels. They are the master point of different divergent channels. We will discuss them shortly. जब उनका टर्न आएगा हम समझेंगे. So they are the divergent channel of the pathway, and we know the CB17 is the wonderful point. CB17 एक बहुत ही शानदार बिंदु है जो हमारे दोनों निपल्स के बीच में पाया जाता है और पूरे छाती की एक्टिविटीज को कंट्रोल करता है. It's a wonderful point who is controlling all the activity of the chest cavity. So we can stimulate the CB17, we can sedate or we can just stimulate it. And we will also stimulate the CB12. Generally, we don't sedate the CB12. The CB12 is the wonderful point. CB12 एक शानदार बिंदु है जो हार्ट और स्मॉल इंटेस्टाइन दोनों पर काम करेगा. Now, so what is finally we are doing as per the concept of divergent channel? So the concept of divergent channel, to expel heart fire. So right side GB22, right side UV1, left side UV1, and the left side GB22, these are the primary points for the divergent channel. ये तो हमारे मुख्य बिंदु हो गए. Then we have to stimulate CB17 and the CB12. CB12, generally we don't do sedation. Okay, we can stimulate the CB17 or even we can sedate it because we want to calm down the chest cavity. But CB12 we generally do not sedating, so we are doing gua sha on the CB12. Gua sha. It's a wonderful to do the gua sha. CB12 is the very excellent point because all the young meridian are meeting here, whether the stomach, urinary bladder, gallbladder, small intestine, triple wormer, or the large intestine. So CB12 is the meeting point of all young meridian. So when we are stimulating the CB12, ultimately it's removing unwanted heat from everywhere, including small intestine. तो जब हम CB12 को स्टिमुलेट करते हैं, ये सारे young channels को activate करता है. We know the CB12 is the influential point of all young. So ultimately, this is the protocol. With the help of this protocol, we can do a very nice job. And SI7 plum blossom will enhance the result in this protocol. So 1, 2, 3, 4, 5, 6, 7, only the 7 point gallbladder 22, UV1, gallbladder 22, CB17, CB12, and SI7 plum blossom. Excellent protocol for expelling the fire. बहुत ही शानदार प्रोटोकॉल है जिसके माध्यम से हम फायर को एक्सपेल कर सकते हैं.